Welcome to We the Future, a fond and memorable tribute to our mother, Dr. Hansaben Bhatt. We will be adding more memories, more voices to this collection from those who interacted with her. We are starting the series with the children born in Gitanjali and other hospitals under Dr. Hansaben's care and guidance. Kutch, India, a geographically barren land, sparsely populated by nomadic people with pockets of villages and small town settlements. Motorized transport in the early 70s was minimal. Modern doctors were few and far, and access to medical facilities was rare.
At a time when qualified Indian doctors dreamt and looked at going to the US and the West to be part of a more developed world, a young, beautiful, and talented doctor chose to return to her roots in Kutch, India, with her husband and two daughters. Welcome to a rendezvous with the multifaceted, humane, scientifically oriented, and deeply religious Dr. Hansaben Bhatt through the eyes of those she was instrumental in bringing into this world and others who interacted with her in her professional journey.
Hansaben set up her practice in Gandhidham's main market. Her warm and welcoming nature, her ability to speak with anyone in their mother tongue, and her attitude to treat anyone, be it the poorest of the poor or the rich gentry, soon made Hansaben no Davakhano the go to place for many. The small practice grew to become a hospital in Sector 1 of Gandhidham. She continued her medical visits to various parts of Gandhidham, Adipur, Bhuj, and Bhachau.
During the course of her practice, she saw women's health problems complicated due to neglect, bias, cultural inhibitions, patriarchal mindsets, and so on. So, she started focusing and prioritizing on women's general and reproductive health.
Whenever her patients could not come to her, she went to treat them at any hour of the day or night, wherever they were. In the early days, transport was hard to come by, yet she did not hesitate to visit any patient in and around Gandhidham using the public bus service. Later, she drove to further off villages and settlements in Kutch to serve her patients. At all such difficult times, her husband Chandrakant Bhai Bhatt stood beside her.
But she soon realized that treating patients was not enough. Prevention is better than cure. Creating awareness about health, hygiene, and nutrition was extremely important. To make this happen, she helped conduct numerous medical and health camps, gave lectures at conferences, and participated regularly in radio talk shows.
Her warmth, sincerity, genuineness, and impressive personality galvanized women and others from all strata of society to participate in various social causes. Dr. Hansabin, along with the ladies and other NGOs, organized camps in rural Kutch to create awareness and detect early signs of cancer, women's menstrual hygiene, and safe delivery practices. Without the advent and use of social media, she made network effects happen.
But Dr. Hansaben did not ever rest on her laurels. Although hard pressed for time with her busy schedule, she kept herself abreast with latest trends by taking courses, attending national and international conferences, and pioneering quite a few better practices at her own hospital. She introduced more options for infertility treatment. She was the first in Gandhidham to start antenatal sonography reporting. She was also among the first to start a vaccination center so that young mothers would be encouraged to ensure timely vaccination for their infants. The wise know that knowledge is infinite and human capacity finite. Dr. Hansaben was wise. She knew when a patient's problems were beyond her capacity and capability, but that did not deter her from serving them in the best possible way. Whenever it was required to, she connected her patients to the relevant experts using her extensive local, national, and global network.
Dr. Hansaben's hospital strived to have the highest standards of expertise and hygiene. Every patient was treated equally and with dignity, whether rich or poor, man, woman, or child, from the newborn to the aged. The hospital remained open 24 by 7, 365 days of the year. No one was ever turned away. Those who could not afford the charges were charged minimally. This for her was the best form of philanthropy, service to all, dignity to every being. There was no looking back for Hansaben. She continued working till her last day, till the last hour she lived. We recall the nurses telling us that she helped deliver a baby girl at 2 a.m. on January 26, 2001, and we lost her and her father to the devastating earthquake at 8:50 a.m. a few hours later. No other lives were lost at the hospital on that day. While we end this video, we begin the series We the Future that will be carried forward by children born under Dr. Hansaben's care. Thank you.